If you're over 65, major driving regulation changes take effect in February 2026, affecting over 50 million Americans across every state. These aren't proposals. They're confirmed federal policies with real implementation dates. Hit subscribe now because here's exactly what's changing and what you need to know. Rule number 10. Mandatory cognitive assessments at every renewal. The most significant change, coming February 2026, is mandatory cognitive screening for all drivers over 65 at each license renewal. These aren't simple eye tests you're used to. They're comprehensive evaluations, measuring reaction speed under timed conditions, short-term memory recall with multiple simultaneous information pieces, and decision-making when facing complex scenarios with competing demands. These assessments are modeled after testing protocols developed for military aviation and emergency response operations. Tests take 25 to 40 minutes and include both computer components and practical demonstrations. The scoring evaluates not just completion, but speed and accuracy relative to established benchmarks. What makes this controversial is the universal age-based trigger. A 65-year-old with 4 decades of accident-free driving faces identical mandatory testing as someone with multiple recent violations. The policy doesn't consider individual driving records, history of safe operation, or years of experience. AARP and advocacy organizations challenge the scientific basis, arguing actual driving history provides far more relevant safety data. Research from the American Geriatric Society shows cognitive processing speed naturally declines 15 to 20% between ages 65 and 80. However, experienced drivers compensate through superior judgment, better hazard recognition, and more conservative decision-making. Standardized tests may flag natural age changes without accounting for compensatory skills, making experienced drivers statistically safer. There's also concerning variability in administration. States retain significant discretion in conducting and scoring tests. A driver tested in Florida might face different evaluation criteria than someone in California. Legal experts identify this as potential constitutional violation regarding equal protection. Rule number 9. Dramatic license renewal fee increases. Your current renewal fees range from $20 to $40 regardless of age. Starting February 2026, states can charge up to 3 times standard rates for drivers over 65, with additional fees for each mandated test component. State documents reveal several states planning maximum increases. Projections suggest Florida, Arizona, Texas, and Pennsylvania are considering structures where seniors pay $150 to $250 per renewal compared to current $30 to $40 averages, a 5 to 7-fold increase. The fee structure works on component basis. Cognitive screening tests carry fees ranging $45 to $85. Simulation testing adds $60 to $95. Drivers who fail components and need retesting pay full fees again. No provisions exist for fee waivers, regardless of financial circumstances. Approximately 38% of Americans over 65 live on fixed incomes, primarily Social Security. Median Social Security benefit for retired workers is $1,907 monthly. When renewal costs jump from $30 every 8 years to potentially $200 every 2 to 4 years, that represents significant monthly income percentage. Financial burden extends beyond direct fees. Many need time off work or arrange transportation to distant testing facilities, especially in rural communities. Multiple trips due to failed tests compound costs through lost wages, transportation expenses, and time away from other responsibilities. What's particularly concerning is revenue allocation, and substantial portions of increased fees fund infrastructure for administering expanded testing, facility construction, equipment purchases, staff training. Seniors fund the very system evaluating whether they can continue driving. This creates what economists call self-perpetuating bureaucracy. Rule number 8. Dramatically shortened renewal cycles for seniors. Currently, most Americans renew licenses every 8 years. The new framework creates age-tiered schedules. Drivers between 65 and 74 move to 4-year cycles. Drivers 75 and older face mandatory renewal every 2 years, a 75% reduction from current standards. Each renewal now triggers full testing batteries, cognitive assessments, potentially simulation tests, updated medical documentation, and all associated fees. For a 76-year-old, what used to be one renewal event over 8 years now becomes 4 separate cycles. AARP research shows average DMV visits for seniors currently take approximately 2.5 hours. Under new testing requirements, estimates suggest each visit could extend to 4 to 5 hours. For drivers over 75 facing 2-year cycles, that translates to potentially 20 to 25 hours spent at DMV facilities over 8-year periods, previously requiring one 2.5-hour visit. Physical and logistical challenges multiply for seniors with mobility limitations, without nearby transportation, or with health conditions. Many DMV facilities have limited appointment availability. Reports from pilot programs suggest seniors may need booking appointments 3 to 4 months ahead. There's psychological dimension to compressed timelines. Knowledge of facing comprehensive evaluation every 2 years creates ongoing anxiety. Seniors who narrowly pass assessments know they have only 24 months before facing identical uncertainty. This creates what psychologists call evaluation vigilance, chronic anticipatory stress about upcoming assessments. Rule number 7, mandatory physician reporting requirements. Previously, if physicians observed symptoms potentially affecting patients' driving ability, doctors had discretion. Starting February 2026, this becomes mandatory reporting. Physicians are legally required reporting any patient over 65 to state authorities if identifying conditions potentially impairing driving ability. Reporting obligations trigger through broad factors including cognitive decline signs, visual impairments, conditions affecting motor control, and medications causing drowsiness or impaired judgment. The breadth is substantial. Research shows approximately 58% of adults over 65 take at least one medication affecting alertness. These are necessary medications managing high blood pressure, diabetes, depression, anxiety, chronic pain, and heart disease. Many have no alternatives, yet their presence can trigger mandatory reporting even without any actual driving incidents. American Medical Association surveys found over 40% of physicians expressed discomfort making driving competency judgments because medical training focuses on diagnosis and treatment, not functional assessments. Doctors now face potential legal liability, held accountable if failing to report patients who later have accidents, but also risking malpractice claims if reporting patients who lose licenses and suffer harm from lost independence. Johns Hopkins research demonstrates when patients believe disclosures might be used against them, they become significantly less forthcoming about symptoms. This creates paradox where frameworks supposedly improving safety could actually reduce medical information quality, potentially making care less effective and patients less safe overall. Rule number 6, automatic re-evaluation after any at-fault accident. Under previous frameworks, minor at-fault accidents resulted in driving record points, possible insurance increases, and potentially defensive driving courses. License suspension was generally reserved for serious accidents. The new framework fundamentally alters this for drivers over 70. Under the one mistake rule, any at-fault accident, regardless of severity, automatically triggers complete driving re-evaluation. This isn't simple retesting, it's starting from scratch. You'll face full cognitive assessment batteries, simulation testing if state required, written knowledge tests, and potentially on-road driving examinations. Data shows approximately 12% of all at-fault accidents involve drivers over 70. But severity analysis reveals overwhelming majorities are low-speed parking lot incidents, minor rear-end collisions, or fender benders backing from driveways. These are situations where property damage might be $500 to $2,000. Injuries extremely rare, and incidents occur at speeds under 15 miles per hour. A 72-year-old who taps another vehicle while parking causing perhaps $800 bumper damage with no injuries, now faces comprehensive reevaluation previously reserved for serious safety concerns. That driver must go through weeks or months of scheduling, testing, fees, and evaluation, with permanent license revocation possibility. What makes this particularly troubling is explicit age discrimination embedded in the policy structure. A 35-year-old can have multiple at-fault accidents without triggering automatic re-evaluation. A 45-year-old can accumulate incident patterns, receive traffic violations, and file insurance claims without facing identical consequences. But 72-year-olds with single minor incidents trigger full evaluation gauntlets. Differential treatment is based solely on age, not driving history, pattern of behavior, or incident severity. This represents a fundamental unfairness that many legal experts believe violates constitutional equal protection principles. Rule number 5. Nighttime driving bans for drivers over 75. Under new regulations, states are authorized implementing nighttime driving bans for drivers over 75, with restriction windows potentially starting as early as 7 p.m. and extending through 6 a.m. The stated rationale centers on accident statistics. Data shows nighttime crashes involving drivers over 75 have increased approximately 18% over the past 5 years. Officials cite this as evidence older drivers face nighttime challenges, and restrictions will improve safety. However, Stanford research examined nighttime accident data and controlled for environmental factors, road lighting quality, weather conditions, road maintenance, and other driver actions. When these variables are isolated, actual risk differential between older and younger drivers at night drops approximately 40 to 50%. Significant portions of increased accident rates relate to poor road infrastructure, inadequate lighting, and dangerous other road user behavior. Natural aging does affect night vision. Darkness adjustment ability decreases with age, glare becomes more problematic, and depth perception in low-light conditions can be compromised. However, experienced drivers typically adapt through compensatory behaviors, driving more slowly at night, avoiding unfamiliar routes after dark, increasing following distance. Blanket restriction approaches remove all individual adaptation possibilities. Practical life impact is profound, particularly in northern latitudes or during winter. In cities like Minneapolis, Seattle, or Portland, winter sunset occurs as early as 4:30 p.m. Restriction windows beginning 7 p.m. mean for nearly 6 months yearly, restrictions effectively cover most waking hours outside work time. For 76-year-olds, restrictions eliminate evening social activities, dinner with friends or family, evening religious services, and community organization participation. Social isolation implications are significant. Our research consistently shows social connection is among strongest healthy aging predictors, with isolated seniors experiencing higher depression rates, faster cognitive decline, and poorer physical health outcomes. Rule number 4. Automatic family notification of license issues. Under new family notification protocols, if drivers over 65 are flagged through testing, denied renewals, have license restrictions, or face suspension for any reasons, state authorities are authorized notifying designated family members or emergency contacts directly. The notification system works through emergency contact information drivers provide on applications. This was previously used only for emergency situations. Now it becomes communication channels for authorities, informing family members about testing outcomes, restrictions, and license status changes. Notification isn't optional. Once actions triggering notification occur, family contacts receive information whether drivers want them to or not. This means 70-year-olds who fail cognitive assessments don't just receive DMV notifications themselves. Their adult children or spouses receive identical notifications simultaneously. Drivers have no opportunities to first process information privately or maintain control over disclosure timing and framing. National Institute on Aging Research found approximately 67% of seniors over 70 report they would feel embarrassed or humiliated if family members were notified of driving test failures. Driving ability is closely tied to identity and self-worth for many seniors, representing decades of independence and competence. Loss of control over whether and how to share challenges creates feelings of infantilization and dignity loss. Mental health professionals raised concerns about protocols affecting senior mental health. Anticipatory anxiety of knowing any driving-related issues will automatically be disclosed creates chronic stress. For seniors already dealing with age-related changes and declining independence concerns, removing privacy around driving status adds worry layers and can contribute to depression and anxiety disorders. Notification protocols also have potential altering family dynamics. In many families, there's already underlying tension around aging parents and questions about when independence should be limited. Automatic notification systems essentially deputize family members as informal monitors, creating dynamics where seniors may feel their families are waiting for them to fail. Rule number 3, required driving simulation testing. Starting February 2026, drivers over 65 will be required completing driving simulation tests as part of license renewal in most states. Simulation tests use sophisticated equipment mimicking driving conditions in controlled environments. Setups involve sitting in seats resembling vehicle interiors, gripping steering wheels, operating pedals, and viewing screens presenting computer-generated driving scenarios. Simulations test specific competencies: how quickly you react to unexpected hazards, how well you maintain lane position while managing multiple tasks, how you respond to changing traffic signals, and how you handle adverse conditions like rain or reduced visibility. Federal Highway Administration data shows approximately 4,200 certified simulation testing centers are available nationwide. That's roughly one facility per 75,000 seniors aged 65 and older. This infrastructure limitation means for millions of seniors, particularly in rural areas, nearest testing facilities might be 60 to 90 minutes away or more. The technology was originally developed for training military drivers and emergency responders, populations generally young, with heightened baseline reaction speeds. Simulations prioritize split-second reaction times and rapid decision-making under pressure. While these are driving components, they're not necessarily the most important safe driving predictors for experienced older adults. Studies shown experienced drivers compensate for slower reaction times through better hazard anticipation, more conservative positioning, and superior judgment about avoiding risky situations. 70-year-olds with 45 years accident-free driving developed sophisticated pattern recognition, allowing them identifying potential problems earlier than simulations typically present. However, simulation tests measure raw reaction speed and precision, metrics naturally declining with age even when overall driving safety remains high. Testing processes are typically 35 to 45 minutes long, though this can extend over an hour if equipment issues occur. Each session requires focused concentration on artificial environments looking and feeling different from actual driving. These differences can create disorientation, especially for seniors unaccustomed to video game-style interfaces. Rule number 2, GPS, tracking for flagged senior drivers. Under new regulations, any senior driver over 65 who gets flagged, through failed tests, complaints by family or healthcare providers, at-fault accidents, or other triggering events, can be required installing GPS tracking devices in vehicles, monitoring driving patterns continuously. GPS monitoring systems record detailed driving data, including where you drive and routes taken, how fast you drive, and whether exceeding limits, how long you spend driving each day, what times you drive, how frequently you make various trips, and acceleration and braking patterns supposedly indicating driving smoothness. All information transmits to state authorities in real time. The stated purpose is gathering objective data about actual driving behavior to inform decisions about restrictions or renewals. Officials argue this provides more accurate driving competency pictures than snapshot testing. However, civil liberties organizations raised substantial concerns about invasiveness and potential misuse. Data from pilot programs shows approximately 23% of drivers with GPS devices report modifying driving behavior specifically because knowing they're being watched, rather than because of safety concerns. This observer effect is well documented. People act differently knowing they're under surveillance. For seniors, this can manifest as avoiding necessary trips due to anxiety about being monitored, choosing longer routes because worried about being judged, or driving in ways feeling less natural because focused on what monitoring systems will record. Research on monitoring and stress shows awareness of being tracked creates chronic low-level anxiety, affecting overall well-being. For seniors, this adds stress to driving, already becoming more stressful due to aging-related changes and increased testing requirements. Some report knowledge of GPS monitoring makes them feel under suspicion, treated as if they've already done something wrong. Civil rights attorneys identified this monitoring requirement as potentially the most constitutionally problematic component. The Fourth Amendment protects against unreasonable search and surveillance, and Supreme Court decisions emphasize location tracking constitutes search requiring heightened justification. GPS monitoring requirements apply to individuals who haven't been convicted of crimes. They're being monitored simply because they failed tests or someone filed complaints. The framework provides no clear timeline for when monitoring can be removed, potentially creating indefinite surveillance situations for seniors who simply want to maintain their independence. Rule number 1: comprehensive medical documentation requirements. Starting February 2026, drivers over 65 must submit comprehensive medical documentation at each renewal, including detailed physician certification of their fitness to drive. The certification process requires complete physical examinations by licensed physicians within 90 days of renewals. These aren't routine checkups, they're specific examinations focused on assessing driving ability factors. Physicians must evaluate and document vision acuity and field of vision, hearing ability, physical range of motion for steering and pedal operation, cardiovascular condition and sudden incapacitation risk, neurological function including reflexes and coordination, cognitive status including memory and judgment, and any medications affecting alertness. Physicians must then complete standardized state medical certification forms, explicitly stating whether they believe patients are medically fit to drive safely. Forms become licensing record parts and can be requested by authorities anytime. Certifications carry legal weight. If physicians certify someone as fit who later has accidents, physicians could potentially face liability claims. This creates complicated situations for healthcare providers already facing mandatory reporting requirements. Now they must not only report concerning conditions to authorities, but also formally certify fitness regularly. Dual obligations put physicians in positions making definitive judgments about complex functional abilities extending beyond traditional medical assessment. The cost of these examinations typically isn't covered by Medicare or standard health insurance, because they're required for licensing purposes rather than medical treatment. Seniors must pay out of pocket for examinations and certifications, typically costing between $150 and $300. When combined with increased renewal fees and testing costs, total financial burdens of each renewal cycle can easily exceed $400 to $500. Examination requirements also create logistical challenges, particularly for seniors with mobility limitations or in rural areas with limited healthcare access. The 90-day windows mean examinations must be carefully timed. Physician appointments must be scheduled well in advance due to healthcare provider shortages. For seniors with complex medical histories, seeing multiple specialists, coordinating comprehensive assessments may require gathering information from several providers. The framework offers no exemptions for seniors living in medically underserved areas, where finding qualified physicians willing to perform these certifications may be nearly impossible. These changes represent the most comprehensive restructuring of senior driver licensing in modern American history. Every driver over 65 needs to understand what's coming and prepare accordingly. Stay informed about your state's specific implementation timeline and unique requirements. Subscribe now for continued updates, practical guidance, and advocacy resources as these developing regulations roll out nationwide and affect your driving independence.